My name is Yakima Palmer, and I am here with you today to present on breast cyst. I am a certified wellness coach and cannabis educator, a healthcare professor, a member of the medical advisory board with Wakana, and the founder of Yaks Wellness. It's a pleasure to be here with you all today. This month is Breast Cancer Awareness Month, and I do want to take some time to acknowledge those who are fighters, survivors, who have been through breast cancer, and supporting the fighters, admiring the survivors, and honoring the taking and never giving up hope. This is Breast Cancer Awareness Month, and this is a good time for all of us as women and some men to actually get breast exams. In this presentation, you will learn what are cysts of the breast, the causes, symptoms, diagnosis, and treatment options. You ask, what is a cyst of the breast? As you can see in this picture here, we have a breast of a female. In the center is the nipple, and around that you have the lobules. The dark circle is the areola, and where you see the pink bubble is what is considered a cyst of the breast. Breast cysts develop as a result of fluid accumulation inside the glands in the breast. They are usually non-cancerous, also meaning benign. You may have one or multiple breast cysts, and a breast cyst often feels like a grape or a water-filled balloon, but sometimes a breast cyst does feel firm. It depends on the person. They do not require treatment unless the cyst is large and painful or uncomfortable for some. Some symptoms that one can have, you can, during an exam, you will do an exam of the breast, and you may have a smooth, easily movable lump, including around the armpit. You would search around the armpit as well as around the areola and around the breast. Some symptoms can include nipple discharge, which can be clear, yellow, straw-colored, or dark brown. Breast tenderness or pain. Some skin changes such as redness, dimpling, or crusting. And also before and after menstruation cycle, a person could notice an increase or a decrease in the breast lump size, tenderness, or other symptoms may occur. These are some types of cysts that occur in the breast, and breast cysts may be found in one or both of breasts. Having breast cysts does not increase your risk of breast cancer, but having cysts may make it harder to find a new breast lump or other changes that might need evaluation by a doctor. Your breast could feel lumpy or painful when you're menstruating, so it is important to be familiar with how your breasts feel throughout their menstrual cycle so that you will know what changes may occur if they differ from what you usually have. Also, most cysts develop rapidly and they can stay the same size. A small number can shrink or they can continue to grow. Cysts are often small to feel. So if you look at, for instance, the atypical cyst, it's located in the breast area, and actually they're all located in the same location, but there are various types of cysts that one can have. And they can be noticed on an ultrasound, and they can be clear, round-shaped, or have a distinct outline. Larger cysts can be felt in the breast tissue as well. And like I said, they could be firm or soft. And some women can have more than one cyst in their breast. As you can see in the last line, you see a multicircular cyst, which means they can have more than one cyst in that area. They are not harmful or dangerous, but they are sometimes uncomfortable and painful. Researchers do not know what caused these cysts. We do know that they are very common and they do affect women of any age. Cysts are especially common in women between the ages of 45 and 50. They often appear with menopause, when a woman's hormones are changing rapidly, and then they go away after menopause has finished. Now, a lot of men did not know that, and women did not know that men can also have breast lumps. Males can have breast lumps, and their chances of being cancerous is very low. And chances of a Black male of having breast cancer is 70 times lower than that of a Black woman. Males do not usually have any type of routine screening mammograms unless they have been tested previously and will have to get tested often. Male breast cancer is usually discovered when the patient notices a change in the breast. So just like a woman, a male can feel a lump, any type of bloody discharge or clear discharge in the nipple area, any dimpling in the skin, and also an inverted nipple. So it's good to watch out for these signs and symptoms for males as well as females. And if you notice any of these symptoms, you should have them checked out by your practitioner. Also, I do want to mention that it is stated that males having breast cancer during their lifetime is 1 in 83. And they do show that Black people, such as male and female, also are likely to die from breast cancer than their white counterparts. So if you see something, you have to do something. The diagnosis and treatment of a cyst. A physical evaluation is performed by a physician who will perform an extensive exam and workup first. If a cyst is large enough to feel, a doctor will usually offer to drain it using a needle. As you see in the right-hand corner, this is a biopsy needle, and they take a tissue sampling of that area where the cyst is. Cysts are usually not dangerous, and draining them or removing them will help remove the lump and often helps a woman to stop worrying about this. Doctors do not usually drain the cysts that can be seen on an ultrasound, but are often too small to feel. And to drain a cyst, the doctor uses, as you see here, is called a fine needle aspiration. And the needle is very small, and they use it just like a needle that they would use to take blood. I've had this procedure done a couple of months ago as I did my own self-evaluation of my breast and noticed a lump. And I must admit that it was a painful lump area, and I went to my doctor and had this ultrasound done and noticed it was a cyst of my breast and had the fine needle aspiration done. It wasn't too painful at all. It took about a couple hours, and thank God it was a benign cyst. What I used on my painful area of my breast was our powerful Power Pain Cream, and also our Power Hemp MD 900 milligrams. This CBD has pain relieving and anti-inflammatory properties to help calm the body. When I tell you this pain cream helped me with my pain in my breast area, it worked. It helped take down the inflammation, and it helped. Our Power Pain Cream, also known as Dr. Rita's Pain Cream, has CBD and essential oils that are applied to the skin area and offer a faster relief to help ease the pain of discomfort, as I mentioned. This is a full spectrum CBD, and it could provide and will provide, as it helped me, relief from the pain. Alongside of this pain cream, you see the Power Hemp MD tincture, and studies have shown that this tincture as well helps relieve discomfort and pain. I also take this Hemp MD Power 900 milligrams every day for my well-being, and it helped as well take down some of the inflammation. Did you know that the MD formula is actually has the hemp seed oil as our carrier? So it is a powerful tincture that will assist you in your well-being as well. For beginners, it is recommended to use only 3 drops once or twice a day, and I always say start slow. Our products are tested by a third-party lab, so they have passed tests for pesticides, heavy metals, and molds, and we do have COAs located on our website. Again, this is a reminder, please pay attention. This is Breast Cancer Awareness Month, and you have to perform your own self-breast exams, women and men, to get screened. If you feel any type of lump, any type of pain in that area, you must do something about it immediately and go check it out. My name is Yakima Palmer. My website is yakswellness.com. I enjoyed speaking to you about breast cyst and how it is important to do your own self-evaluations to see what's going on in the inside of your body. Thank you. Does anyone have any questions?
Fantastic presentation. I love that because, you know, you never really understand that or realize that men, as well as women, of course, can have issues going on with their breasts. They can have
Yes.
breast cancer. So
Yes.
this was really good to really show a lot of our distributors and our guests that are on the line that, yeah, men need to be vigilant about their breasts as well as women, and that these products can be used for procedures. They can be used post-op procedures, post-operatively after your procedures, and really give one relief like it gave you. So thank you so much for this presentation.
Thank you. See, do we have questions? Should a biopsy be done for all lumps found? Yes. In my opinion, I would say yes. Dr. Rita, do you suggest that a biopsy should be done for all lumps?
A lot of times the breast may be lumpy due to fibrocystic disease.
Mm-hmm.
And if an evaluation is done via ultrasound or an evaluation is done via mammogram and it just shows some fibrocystic changes, then no.
Okay.
But if the lump presents itself and an ultrasound or mammogram is done and there's suspicion for either a cancerous or a precancerous or a cystic area that needs to be evaluated, where fluid can be obtained, then yes. But
Okay,
not all lumps need to be biopsied. All lumps need to be evaluated. They need to be evaluated by a doctor. And after that, possibly an ultrasound and mammogram, but not all lumps need to be biopsied.
okay, thank you.
You're welcome. That was a great question.
Any other questions for me?
And I must say, thank you for bringing awareness to self-breast exams, because 90% of breast cancers are found by the patient.
Yes, they are. And I've had lots of family members perform their own evaluation, their own exams, and notice lumps as well. So we've all had to check, and it's very important that you do your self-evaluation at least once a month. And Kim Powell states, does the pain indicate issues when you know you have fibrocystic breast?
Well, fibrocystic breasts will cause pain. So if you're asking if pain means there's something bad going on, then no, not necessarily. Pain can be from a benign cyst like fibrocystic breast disease, if that's what she's asking.
And the pain cream will definitely, well, it helped for me, help with the pain and the swelling of my tissues. Yes, that's what you're asking. Thank you, Kim. I hope we answered your question correctly. Good. Okay, well, I appreciate you all listening to me this evening. And if you have not gone and had your breast exam yet, I advise you to do that soon, and also do your own monthly breast exam. As I stated before, men and women should do this on their breast and chest area, and especially under your lymph nodes as well too.
Thank you so much,
Thank you.
Yakima. And if we have any guests on the line, please connect with the person that invited you. Oh, welcome, Kim. Kim is a new distributor. Welcome, welcome, Kim. We appreciate you and your questions tonight. So if you're a guest on the line, please connect with the person that invited you. If you are a distributor on the line, please remember to invite all of your guests every Wednesday evening for the Medical Advisory Board presentation. So thank you again, Yakima. Thank you, business partners. Thank you, guests. Have an amazing rest of your evening.
Happy birthday, Dr. Rita.
Oh, thank you
I had
so
to sneak
much.
that in
Thank
there.
you. Thank you, Erica.
I had to sneak it in. Happy birthday.
Happy birthday. You all have a great evening, and thank you.